So, good evening, everyone. Welcome to my one day masterclass on the reality therapy. So, I am Ria Khurania. I have completed my master's in counseling and family therapy, and I am the founder and the therapist at the Psychic Mantra. Along with being a therapist, I am also a career coach, NLP master practitioner, mental health coach, and expert in psychological first aid, women empowerment coach, and a parent coach. So, I basically work with the children, adolescent, adults, couples, family, geriatric clients, LGBTQ community, and in the group therapy. So this is about me. Before we start, can we have a quick intro that what is your name and from where are you joining? If you want, you can open your mic. Otherwise, you can type it out in the chat box.
Hi.
Hi,
Am I?
Tanvi ma'am.
Yeah, I'm Tanvi Singh, and I have completed my masters from University. I'm from Gurgaon. So
Oh,
right now I am working as a trainee psychologist at Mind.
okay, amazing. And Akanksha ma'am, you raise your hand.
Uh, Hi, I'm Akanksha Jain. I'm from Delhi and I'm a person from varied profile. I'm 10 years experience with education, curriculum, teacher training coordinator, and currently I'm a freelancing public speaking skills trainer. So I'm joining this session with a lot of enthusiasm. I am really interested in psychology and learning things more and more. Yeah, thank you.
Amazing, ma'am. Amazing. In this session, we will cover some beginner-friendly things about the reality therapy. So, whether you are a professional person, whether you are a completely new to this therapy, so you will understand this. And in the end of the session, we will learn few activities that, as a therapist, as a coach, as a person, you can apply it on the clients. Yes, ma'am. Okay. Anyone else who want to introduce themselves? Okay. I hope no. If you still want, you can just type it in the chat box. Okay. So, okay. Welcome, Ashwita ma'am. Okay, so this is the agenda for our today's workshop. Basically, today we will learn that what is reality therapy. Then we will learn that who created it and why. Then we will learn that how it is different from the general talk therapy or the general psychotherapies that we use in our day-to-day life sessions as a therapist. Then how to use it with the resistant client and when to use it. It's like when your client is completely resistant, when they don't want to communicate with you, when they don't feel safe with you. So at that time, how you can use the psychotherapy with those clients. Then we will learn about the choice theory, which is the foundation of the reality therapy. Then we understand that why reality therapy work and how we can integrate it with the other psychotherapies. Then we will learn some practical tools, then we have a case study, and then we will conclude this workshop. So this is the agenda for today's workshop, that what exactly we are going to do. Now, first thing first, that is what is reality therapy. Anyone who knows about this psychotherapy, or is it completely new to you? I just want to make this workshop little bit interactive, so you will also not feel very bored, and you can just interact with me, so that if you have anything that is wrong or anything that is right, we can build that foundation also. Okay, definitely. Want doing evaluation planning? Yes, this is WDEP model, and it's new for few people, as I can see in the comments. Anyone else? Okay, it's fine. It's fine. So, what is reality therapy? So, reality therapy is a counseling approach that focus on the present choices, personal responsibility, and practical action rather than blaming the past. Okay, so it's about, it's, you can say it as a action focused therapy, in which we focus on the action instead of blaming the past. It's like there are a lot of clients, if they have any trauma, any anxiety, or anything that is stuck in their mind, they always try to be in the past, like in the past this happened, in the past that happened, and because of that I cannot do this thing, I cannot do that thing. They don't take the personal responsibility, that right now what are the things that I can do, what are the present choices, what are the new options that I have right now. So by using this therapy, by using this psychotherapy, we help the client so that they can take action, they can see that what are the things that are in their control, and now what are the choices that they can make in their life now, so that they can move forward. So it is an action focused psychotherapy. Like for example, if a client is stuck in their job, they hate might focus less on that why I ended up here, and more on that what are the small steps can I take this week towards a better career. It's like instead of just stucking in the past, now they are seeing that what are the possibilities, what are the other options, what are the solution to this thing, so that they can move forward in their life. Okay, so this is what the reality therapy is. Now, who created it and why? So this psychotherapy is developed by Dr. William Glasser in 1960s. So basically, he believed that many people feel stuck because they are focused on what they couldn't control instead of what they could. It's like you can think it with an example that you have 32 teeth in your mouth. Okay, so now in one teeth there is one thing that is stuck in that teeth. Okay, so your whole focus will be on that single tooth instead of that 31 correct tooth that are functioning completely fine. So in this thing is a lot of, with a lot of the people the same thing happen, that when the people are stuck, when they see like that they don't have any options, or what are the things that is going in their life, so at that time they try to focus and they try to control those things that are not in their control. It's like I love someone, so why they are not loving me, what can I do so that they can love me, so is there anything that is wrong with me, something like this, or what I can how I can pressurize that person so that they can love me. So this is like a loop in which we are trying to control that situation that are beyond our control. Okay, and because of that people feel stuck, they feel demotivated, they got a lot of the psychological disorders. Okay, so that's why Dr. William Glasser work with work with these things, and that's how the reality therapy was born, to help the client to take the ownership, to take the responsibility, and create a change through the choices, that what are the choices that I have, what are the things that are in my control. Okay, like for example, instead of telling a student that you have to behave or you will be punished, Glasser encouraged the teacher to ask that what do you want right now, and is what you are doing helping you get there. So it's like we are telling them to behave or otherwise you will be punished. We are asking that okay, what is the need, what is the thing that you want right now, and how I can provide that thing to you, and what are the other options. So this is how we are asked, instead of just asking about the things, we are working on the actions, that what are the actions now I can take in this situation. Is it clear till now, or am I going too fast? Just give me a thumbs up. Perfect. Now we can move to the next slide, that is how it is different from the general talk therapy. Okay, so now in this, how it is different from the other psychotherapies, or why we have to learn about this, why we have to use it on the client. Okay, and why as a psychologist we need to learn about this. So why, how it is different, so it is a present focus, not the past dwelling. In this psychotherapy we are focusing on the present thing, we are focusing on that what are the things that we can do forward. We are not dwelling into the past, that whatever has happened. Now we will focus on the present, that what we can do in this present scenario. Next is no blame, no excuses. We are focusing on the responsibility. Okay, we are not working on that the blames, the excuses that you hold. We are focusing on the responsibility. It's like, what are the responsibilities that I can take in this situation? What are the things that I can do in this situation? It's like, you have a conflict in your office, so at that time, instead of just saying that I have a very bad destiny or everyone is against me, now I am focusing on, instead of blaming myself or giving the excuses, now I am focusing on the responsibilities. Like, in this toxic environment, what are the things I can do to make the things better, I can do to make my mental health better. So this is like, we are focusing on the responsibilities, we are focusing on the possibilities that what we can do. Next is more action oriented than insights only model. So basically it is more action oriented, that what are the actions we can take now, instead of just thinking about the models, instead of just getting the insights about the problem, about the situations, and about the things. Like for example, in a conflict, instead of exploring the childhood patterns for months, clients in the reality therapy are asked that what can you do now to improve that situation. Okay, so in basic, if you have seen the case history forms, if you have seen about all of those things, so on those things we basically focus on the childhood things, we basically focus on the past of the client. But in reality therapy, we ask the client that what are the actions they can do to move forward in their life. Okay, now, what are the resemblance of the psychotherapies with the other psychotherapies? It's like, what are the common points in between reality therapy with the other things? So reality therapy share the features with the Eulerian therapy because both believe that behavior is purposeful and goal oriented. Okay, so in this, reality therapy have the resemblance with the Eulerian therapy, with both beliefs, both have the same focus on the behavior, which say that behavior is purposeful and goal oriented. It's like, you have to do that behavior that will make sure that you will reach the goal that you have set for yourself, for your life, and for each and everything. Next is the motivational interviewing. So in both of these psychotherapy, we work on the client autonomy. It's like the client will take the responsibility, the in which we are working on the client itself, that what are the things that the client feel, so that the client will feel safe, they will feel confident, they will feel that no one is judging them. And with the collaboration with the therapist, they can move forward, we can create that motivation in the client, so that now they can take the action. Third is the solution focused brief therapy, that is SFBT, which is a future focused, action based, and the minimal focus on the problem story. So solution focused brief therapy say that we have to focus on the present and on the future, instead of focusing on the past. We have to work on the problem solving, we have to work on the action based thing, so that there is a minimal focus on the problem, and we will focus on the solutions, so that we can move forward in our life. Okay, like for example, like in SFBT, reality therapy might ask that what one small change you can make this week that would bring you closer to what you want. So this is like how solution focused brief therapy and reality therapies are related with each other. Like in both of these things, this is the same thing, in which we are focusing on the future thing, we are focusing on what are the actions they can take, so that they can reach the goal that we have set in the therapy, or the client has set for their life. Okay, is it clear till now?
Yes, ma'am.
Okay, now how it is different from other therapies, psychotherapies. So basically now we have learned that how they are what are the resemblance with the other psychotherapies. Next, how it is different from the other psychotherapies. So in this, no diagnostic label as the focus. So it's not about treating the depression, but about meeting the needs effectively. It's like, behind a lot of the emotional issues, behind a lot of the things, there is a need of the client that is not being fulfilled. Like in the couple counseling, when the couple is constantly fighting, so each individual have their own needs that are not being fulfilled, and because of that thing, because of the things that they cannot process, because of all those things, they are fighting with each other, and that has resulted in the conflict. So in this thing we are focusing on that what are the needs of the client, so that after fulfilling them the client can move forward in their life. So that's why it's a non-diagnostic label as the focus. Next is less emphasis is on the past. So in this, as I told you, we will focus on the present and on the future choices, not on the past, that what are the things they have done and all of that thing. So it's like a present and future choices. Next is no excuses for philosophy. So even in the tough circumstances there is always a choice you can make. It's like if you have an exam tomorrow, so you have a choice that either you can read, either you can use the phone. So in every situation there is a choice that you have to make. So here there is a no excuse policy, in which you will have to make a choice, you have to take the responsibility. If anything get better, then of course it's your choice, and if anything goes wrong, then of course it is your choice. So it's a no excuse philosophy. So that's why it is an action focused psychotherapy. Next is action every session. So each session and ends with a specific and a realistic plan, that what are the things that you are going to do in the next week. It's a realistic plan that you have to follow, so that you can become more action oriented. It's like you can think it like that next week you have an exam. So right now in the session we will plan your whole week, like in the each day you will read one chapter, or you will revise two chapter, anything like this, so that when in the next week when you have the exam, the plan can be executed. You can get a realistic plan that you can apply. Okay, so that's why it's a non-diagnostic label as the focus, less emphasis is on the past, and no excuse philosophy, and it's a action every session psychotherapy. For example, in rebt you might challenge the belief that I am worthless, but in our reality therapy you will also decide that what will you do this week to treat yourself like you have the value, so that the automatic thought that you have, or the cognitive distortion that you have, can be challenged with the action thing, and it can be replaced on the behavioral perspective and even on the thoughts perspective. Okay, is it clear till now? Okay, now mm, uh, am I audible now?
Yes.
Yes, ma'am.
Sorry, suddenly my wi-fi was off. I don't know why, how. Okay, so first thing is, whenever the client came to us during the case history or while talking to the clients, we understand, or by their words we understand, that they are blaming on the other people for their own choices and even the circumstances. It's like when in the morning my just alarm goes off, and that's why I didn't get up and didn't get to the place on the time. Okay, it's like they are just blaming the circumstances, they are not taking the responsibilities on their own, they are not looking at their own actions. Like for example, I have a case of a old 60 plus man. He basically blames his wife for his own actions. He feels like that okay, he is sick, although he is not that much sick, he can handle each and everything by his own, but he feels like okay, I have depression or I have some psychological thing, so it's like my family responsibility to treat me well, it's my family responsibility to give me each and everything. On the other side, the family is trying to give each and everything. If there is one thing that is not according to him, he will not talk to his family for like 1 week. Clearly he gives the silent treatment to them. So it's like he is blaming the other people, he is blaming the circumstances. So in these cases we have to work with the reality therapy, okay, in these situations, because it will make them more action oriented. It will make the person to take the responsibility on their own instead of just blaming the others. Next thing is, client is saying that nothing will change. when they have these kind of the statement that nothing will change, I have taken one or two times, I have do something but nothing has changed, I was not constant for one thing, single thing, but there is no hope, no things like that. So at that point also the reality therapy can become a base, so that the hope, the positivity of the client can be restored by the actions they will take in the following week. It's like if they are saying that okay, in the next week I have an exam, I didn't read till now, and I know that nothing will change, I will not get a good score. So at that time, by the actions they can see that if they are constant, if they are doing the practice on the daily basis, then definitely they can have a good score. So at that point, with the actions we can work with their thoughts, with their negative thoughts that they have about themselves and about the others. Next is when someone has the insight but isn't taking the action. They know that something is wrong. They know that they have to take the actions. They know that they have to. They it's like they have the knowledge about everything, but they are not able to take the actions. They are not taking the responsibilities. They are not changing their behavior, their habits. So reality therapy. Just a second. Why it's fluctuating? Am I audible?
Yes.
Okay. Now, the now next is the relationship conflict, motivation issue, and the habit change. So when the client is not able to change their habits, they have the relationship conflicts, and in the conflicts they are just blaming each other. They are not taking the responsibilities, they are not doing the changes. So at that point, or in the couple counseling, we can use the reality therapy, so that the conflicts can be resolved, the motivation issues, because sometimes when they didn't take any action, they cannot feel motivated. They do have a continuous negative thoughts about the situation, about the things. So that's why in these issue also we can use the reality therapy, so that they can see, they can do the actions, they can take the responsibilities, they can make the choices, and with all of those things the motivation can be restored in the client's life. Okay, so that's why you can here in these situations you can use this. Now, with the resistant client, how to use it? In this thing, first you have to build the trust before pushing for the change. So, if you are working with the client, instead of just asking them to go with the change, instead of just asking them that okay, you have to change each and everything in your life, you have to build the trust. Trust means you have to form the rapport with the client. You have to make sure that the client feels safe, the client feel that the therapist is with me, and together we can find the solution. So that instead of just pushing the client, we are giving them the environment so that they can do the choices and move forward. Next is you can use the curious non-threatening questions. Okay, sometime with some clients, when they don't have the insight, sometime asking the direct questions, or sometime asking some questions can be triggering to the client. Okay, so at that time asking the curious and the non-threatening questions are something that will make the rapport, or in the initial stages that will make the confidence in that client. Otherwise it will break the rapport and the client will never come back to you. So you have to ask the question like that, what do you want to be different? Instead of just asking them that you have to study or you have to do the meditation for the 30 minutes on the daily basis, we are asking the client that what are the things that you can do differently. Okay, what are the options that you have, so that first the client will itself explore the options, they will itself understand the thing, and after that the client after that the therapist can add the few things in their schedule, in their intervention plan, and we can give them the variety of the choices. Like if if you don't want to do a 30 minute of meditation, then it's that okay if we go with the art therapy, cinema therapy, or other expressive art therapy. Okay, it's like this, it's like that in this thing, so that the client will feel curious, the client will feel like that yes, it is my choice, it's like my thing, and I have to take the responsibility. It's like if I ask you to just eat two chapatis, maybe it will trigger you that why I will eat only two chapatis, I want three chapatis, or I don't like chapati. Okay, but if I will give you the different options, it's like go with the either go with the chapati, with the rice, with the pulao, biryani, or anything like that, then you might also feel very confident that okay, now I have a variety of the things and I can do whatever I want. So it's like we are giving the control in the client's hand, so that they can select for whatever they want and they can move forward. Okay, next is the celebrate the small wins early to build the momentum. So when we are working on the behavior, when we are working on the habit formation, so at that point the small wins we have to focus on them. It's like if I ask my client, or it's like in the homework I told them, it's like that they have to go to the park on for next 1 week. If they go to the park only for the 3 days, so I will celebrate the small win. Or if they will just go to the park, or they will just touch the gate of the park for the next 7 day, I will celebrate the small win, so that the motivation can be created in the client. The client will also feel confident that last time when I did my homework, the therapist was happy and she just appreciated me, so that's why they also feel good in themselves. So this is how, by creating the small wins in the early situation, if they have done the like 10% or the 20% of the thing, then also we will create this thing so that they can move forward with a good momentum. This will keep them motivated, this will make focused that they can move more forward in their life. And that's why over a period of time a new habit or a new behavior can be created in the client's life. Is it clear? Any doubts? Okay, I hope I'm making sense to you now.
Yeah, I have one doubt. Like,
Yes.
if we celebrate every time, it's like if he done for 10%, 20%, but how will they like motivate you? Have to complete 100%.
Okay, so when they have completed like 10%, it's like this is our first session and I gave you the homework. In the next session you came and told me that I have completed only 10%, then I will appreciate you that oh well done, you at least you have completed the 10%. It means you have the motivation, it means you have the power. And now I am sure that in the next session when you will come back, you will do the homework. So in the next session the client will automatically try to go for the 20% or the 30%. And then in the again next session, instead of just focusing on the 10%, I will also say that oh last time you only did the 10% and now you have completed the 20% or the 30% of the homework. Then in the next session I am sure that you will go with the 100%. Okay, it's like I will increase the intensity, I will increase the uh, percentage of the work. Okay, it's not like in the
Yeah.
each session I am doing that thing in the first session, so that it will create the momentum in the client for the next session onwards, and automatically they will try to do more. It's like if you are very weak in maths, if you came to me and you told me that I have only do the two sums on the first day, and in that one is right and one is wrong, so instead of just focusing on the wrong I will focus on the right one, so that you will be motivated, and next time you will again try for next three sums. In that three sums maybe you will get two right, and in that thing instead of just focusing on what is wrong I will focus on what is right, and gradually I will increase the exposure. Okay,
Okay.
so this is
Thank
like
you.
that. Okay, now the next thing is that how many sessions are required for the reality therapy. So it's a short term change. If you are going for a short term change, then 4 to 8 session is enough. It's like a single issue and motivated client. If your client is motivated and if they have only single issue is like I only have a conflict in my office and everything is fine, so at that point short term change only required 4 to 8 session. Then if the client have the multiple issue, and if the client have some resistant, it's like they have the insight but still they are resistant. So at that point, with the moderate complexity, you will require 8 to 12 sessions. Next is the long term pattern. If there is a deep lifestyle shifts, if there are multiple issues, if they are extremely resistant, so at that point, 12 to 20 plus sessions are required with the client, with the reality therapy. And it can be used alone, and it can be blended with the other psychotherapies. It's like, if you want, you can either use it all alone, like the CBT technique, or otherwise you can blend it with the other psychotherapies. It's like, today in the session I am using one technique from the CBT and one technique from the reality therapy. And also it can be used when sometimes the client came to us and they just want to do the catharsis, and they just are looking for some solutions for the problem. They only just came us for only one session. So at that point also, you can go with the WDEP worksheet that we will discuss in this session, and this could be like a perfect session for them. Okay, so like the tip in this thing is, reassess after the 4 to 5 session and check if the needs and brings meet more effectively. It's like, after 4 to 5 session, if you are a normal therapist, if you are using reality therapy or any other psychotherapy, just reassess after 4 to 5 session, that whatever the goals you have making, whatever the needs the client have, whatever the things that you have planned, is it working or not. If it is not working, then you have to change the technique, you have to change the approach with that client. So this is the important tip. If you are a therapist, if you are dealing with the people, if you are in any kind of the work which required the people and you are training them in any form, so after 4 to 5 session you have to reassess the thing. Because so if they, you cannot see the changes after 4 to 5 session with any client, it means your approach is this approach is not working with them, or is there is something wrong with the client. Either they are not more engaging, either this technique is not working, or there is something that is missing in the session, and that's why they are not doing that thing in a proper manner. So you have to make sure to reassess each and everything after the 4 to 5 sessions. Okay, so now, what is the choice theory? Choice theory, which is the foundation of the reality therapy. So the choice theory says, before I start, anyone who want to explain the choice theory, have you heard about it, read about it? Anyone? Okay. So basically, the choice theory says that all our behavior is chosen to meet one or more of our five basic needs. It's like, there are the five basic needs, and our all behavior directly or indirectly meet those five basic needs. Okay, so if the needs are not being fulfilled, so then automatically we cannot control the if their needs are not being fulfilled, then automatically it will cause the issue. We will not engage in the behavior, we will like, we feel very angry, we will feel a lot of the emotional rush. So in this thing, we cannot control the other, we can only control our actions and our thinking. So to get all of those needs, we cannot control the others, we cannot just rely on the others to make us feel more confident, or give us to fulfill all our needs. We can only control our actions, our thinkings, and our all things. Okay, and changing that, what we do and think changes that how we feels and how our body responds. So when you will change that how we think and how, it's like, uh, if you have learned about the CBT, so there is a triangle which say that thoughts, behavior, and emotion, they, these three things are interlinked with each other. If your thoughts has been changed, then automatically it will impact your emotions, and it will help to change your behavior. So automatically in the choice theory we are focusing on the behavior, so it can changes our thoughts, and when it will change our thoughts, then the emotion will become balanced, and when the emotion will be balanced, it will reinforce, positively reinforce our behavior to do more good. So this is about the choice theory, in which we have to focus on our all the five needs. If those five needs are not being fulfilled, then automatically we have to do the choices, we have to take the control, we have to focus on the actions and our thinking. And if we do the changes, if we take the action, then automatically our thinking will be changed, and how we feel and or our how our body will respond, these all things are changed. Like for example, someone might gossip to feel belonging. So in the reality therapy we find the healthier ways to meet that same needs. Okay, so someone who just gossip the things so that they can feel the belonging, they can feel that yes, I'm also important. In the reality therapy we will find the healthier way so that those needs can be fulfilled. So now these are the five basic needs that we have. So first thing is for the survival, that for the survival we do need the food, shelter, safety and the health. It's like our survival needs. First of all, if these needs are being fulfilled, then we do need the love and the belonging. So if the love and the belonging needs are there, so we need healthy relationship, we need good intimacy, we need the acceptance in the social settings. Next is the power, we do need the achievements, we want ourselves to be more competent, and we want to influence the people so that we will have the power in our hand. Then is the freedom, that is autonomy. It's like my voice, my things, I have that thing. Next is the independence and the choice to do the things. When next is the fun, which includes the playfulness, enjoyment and the creativity. So these are the five basic needs. Like in the relationship issues, basically you can see the love and the belonging is not being there. There is no, that's why if there is an intimacy issue, the love and the belonging is not there, and if this need is not being fulfilled, then the couple will have that fight. The power thing, that's why a person try to dominate the other person, they try to achieve more, whether they can select the right or the wrong path, because this need is not being fulfilled. Then is the freedom, feminism, this is also a type of a freedom that we want, and because of that thing, when it is not fulfilled, because of that need, now we are struggling, now we are fighting, now we want that choice. Okay, so these are the five basic needs. So when a client is in front of us, we have to understand that what is the basic needs the client that is not fulfilled in that client. Okay, in the behavioral issues, in the conduct disorders, basically with the child and the adolescent, even in the adults, you can see that there is a need that is not being fulfilled. If a person try to bullies other person, then definitely they need the either the power, they need the freedom, that okay, everyone will accepts me, it's like my choices, they need that independence because they are being suffered at their home. Okay, they don't have that freedom or power thing in their life. So that's why behind everything, a lot of the things, basically there is a need that is not being fulfilled, and that's belong to these five basic needs. That's why in the choice theory we focus on these needs, we focus on all of these things. In the couple counseling also, we try to understand these needs of the people. In the premarital counseling also, we work on these needs so that we can find that whether the both partners are compatible with each other or not. Okay, and sometime when these needs are not being fulfilled, that can lead the childhood trauma in the client. It's like from the childhood, if you will have the financial crisis, then your survival needs are not being fulfilled, and because of that, maybe your self esteem is low, maybe you don't feel confident in the around the other people, or when someone try to just ask you about anything, you may find out that this is very triggering to you. Okay, so like for example, a child acting out, maybe trying to meet the power and the fun needs, but in the ineffective way. It's like if a child is shouting again and again and again, if they are showing a lot of the tantrums, it means the need for the power, the need for the fun, and even the need for the love and belonging is not fulfilled. And that's why they are showing the tantrums again and again, which is an ineffective or which is an unhealthy habit. Now it's clear that what is the choice theory and what are the five basic needs. Okay, then we can move to the quality world and the perceived world. Okay, so the quality world is our photo album of what we want the most, and the perceived world is the reality as we experience it. Okay, if I ask you that what is your perfect world, a photo album world which have everything right, so you may say a lot of the different thing, or also this can be used as the activity with the client to understand their needs. It's like what is your perfect world, what is your happiest place, in which they will write that what are the things that are missing in their current life, that is present it over there. Okay, next is the perceived world, which is the reality, the world in which you are. Okay, the world or the surroundings that is around you, or the situation or the things you experience right now. So this is what the quality world is and the perceived world is. If the gap is bigger or the difference is bigger, it's like you are a complete failure. And now it's like you just score 10 number out of 100, and now you want to score 99 out of 100. Okay, if the gap, you can see that the quality world is 99 and the perceived world is 10. So if the bigger the difference, the higher the difference in between the quality and the perceived world, the greater is the frustration, because everyone wants a perfect life for themselves. If they cannot find that thing, if they cannot find that picture perfect thing of the things that they have imagined about themselves, if they are not living that thing, then the higher the frustration they will feel, the higher they will feel very angry. They will feel a lot of the emotional they have a lot of the emotional overwhelming things. Okay, so that's why we have to understand their whole two worlds, that what are the things that they want and what are the things, or what is the reality, or what is the experience they have. If there is a greater things, if there is a greater difference, then automatically it will lead more frustration, the needs are not being fulfilled, it will lead towards the negative thoughts, like negative thoughts towards the spiral negative thoughts, and again it will impact the emotions, and automatically it will impact the behavior or the actions of the client. Like for example, the client quality world include a peaceful home, but their perceived world is filled with the arguments. So at this point, reality therapy can help as a bridge to gap. Okay, so as you can see, the conflict is in the client because they need peaceful home, but they have a lot of arguments. Okay, so because of these things they feel frustrated, they have a lot of issues. Okay, and now in this thing the reality therapy will bridge the gap. Now the next thing is the total behavioral model. So in this, which say that behavior is consist of acting plus thinking plus feeling plus physiology. All of those four things combine to create a behavior. Like for example, if anxious is a feeling, slow breathing is a acting, positive self talk is a thinking, and can calm heartbeat, this is the physiology. So we have the direct control on the acting and the thinking, that what are the things that we are acted out, we are doing. Next, what is the thing we are thinking. These two things, on these two things we have the control. So if we have to work on the client's behavior, on their habit, we have to work on their acting part and on their thinking part. And next is the indirect control. So if these two things are in control, then automatically, definitely, ma'am, it's completely fine. You will get the recordings. You can watch it afterwards. I hope you will have a great interview. All the best from my end. Okay. So Yes, so you have a direct control on the acting and thinking, and there is an indirect control on the feeling and the physiology. So if these two things are in the control, that is your acting and the thinking, then automatically you can focus and you can work on the on the feeling and the physiology part. Okay, so now why reality therapy works. So reality therapy focuses on what is controllable now, and that's why it will turn the insights into the immediate actions and shift the helplessness to the empowerment and encourage the healthy and the responsible need meeting. Okay, so why it works? Because it will help the it will focus on that what is the things that I can control right now, what are the immediate actions, or what are the actions, or what are the changes I can do in my lifestyle, so that I can work with that situation. This will shift the helplessness that I am feeling, that I cannot control everything, I'm not able to do anything. This will change this thing to the empowerment. Next, it will encourage the healthy and the responsible need meeting. It's like the five needs that I have, and because of that thing, the frustration that is around them, now I will have the options. This will encourage me to select the healthy option so that that need can be meted. Like for example, this you can see this in the emotional eating. Okay, in which the client is feeling that emotional void, they are not feeling emotionally good, the need for the love and the belongingness is not being fulfilled, and to fulfill that thing they eat a lot. Okay, so they undergo the binge eating, the eating disorder happened due to this. Now we have to teach them the healthier alternatives that they can do, the actions they can do, so that the emotional void, the need the client have, can be fulfilled and they can move forward in their life. Like for example, instead of waiting for the other instead of waiting for others to change, a client can work on their own boundaries to improve the relationship. So in the couple counseling, this is also one of the things that we do. Instead of asking that what are the changes the couple wants in each other, we focus on what are the things that they can give on the table, so that the relationship can be improved. So this is a simplest example to understand that how it works. Now, in this thing, what is the role of the therapist? So the therapist build the trust, no judgments. Okay, it's like the therapist will build the trust with the client and will not judge the client on anything. Okay, next is avoid the threats or the punishment. In this, we are not giving the threats or punishments to the client. We are not saying that if you didn't do this thing, or by the next week if you will not go to the park, I will punish you, I will scold you, I will terminate the sessions or anything like this. So avoid the threats and the punishment. Next is the help the client to evaluate the choices, that what are the choices the client have, and what are the things that they can do, and in those choices what are the things that client want to do. So in this, we have to evaluate the choices, help the client so that they can evaluate the choices that they have. Next is support the realistic doable plan. It's like a client came to me and they say that they need a good social circle, and by the next 2 days they will get 200 friends in a single day, 200 best friends. So this is completely non-realistic plan, this is a completely imaginary plan. If they don't do this, they might feel negative about it. So we have to support the realistic thing, the things that client can do, the plans that are doable. So that's why we have to create the smart plans to them, smart, smart. Okay, so that plans to them. Like for example, is this choice getting you closer to the life you want? It's like the quality world that you want, is this choice, the thing that you are doing, is it getting you close to them? Instead of you must stop doing it. It's like, that's why it is a it's a type of a Socratic questioning that we usually do. In this, we are asking them the choice or the action they are doing. Are they giving the needs that they want, and are they going to, or are they become closer to the life that they want? If yes, then definitely do it. If not, then you have to change it. By just asking this question, we can give them the insight. This is how they will see the responsibility. This is how they will see, this will work on their thinking part, that yes, if this action is not helping me out, then definitely I have to change it. And that's why, instead of just confronting them, we are giving them the insight, we are giving them the motivation for the change. Okay, so this is the role of the therapist. Is it clear? Okay, just a second. So now, the WDEP framework, which is like the core of the reality therapy. W means what are the wants, D means doing, E means evaluation, and P is the planning. Okay, so in the wants, we will ask the client that what do you really want, what are the needs the client have. Okay, the D is the doing, that what are you doing to get it. Okay, what are the actions you are taking. Then we are evaluating, is it working or not working to you, or what. Then we will plan that what will you do the next. Like for example, I want to feel healthier and I am eating fast food only. I want to be healthier, this is my quality world, but right now, or in my perceived world, I am only eating the fast food. And now we are evaluating the thing whether it is helping or not. So the client will say no, it is not helping, the junk food will not make me healthier. And this will give the insight, this has given the insight to the client. And that's why now they are planning that cook two home meals this week. This is how now they will take the action to lead toward the need that they want. Now clear that how WDEP framework works? Okay. Now, integrating with the other approaches. Now, till now, we have understand that what is reality therapy, choice theory, how does the action work, how does it works, how it is different from the other psychotherapies, what are the similarities and all. But now we will understand that how we can integrate this approach with the other psychotherapies. So first is the CBT, that is the cognitive behavior therapy. In the cognitive behavior therapy, you can add the choice making through to the thought work. Because in the thought work, if you will ask the client to change the thought directly, okay, to just reframe it directly, this might not happens with them. So to do this thing, we will give them the choices. We will ask them that okay, what are the needs, the in the your behavior, what are the main needs behind the thought, what are the needs you have that is not being fulfilled. So in the CBT, we can add this thing, we can add the choices, we can ask the client to just select in between the different techniques of the CBT that they can apply in their life. Like in the CBT, we can add the WDEP model. Next is the REBT. So in this, we are working on the challenge beliefs, then create a action plan. So now in this, we will focus on the challenge beliefs. We will challenge the beliefs the client hold for themselves by creating the action plan. If I say like this, that I cannot do anything good, okay, so I have this plan or I have this thought. So instead of just focusing on the thought, I'm focusing on the actions that I can do, so that this thought can be replaced, or I can prove with my actions that this thought or this belief that I hold is not good. Okay, it's not correct. So automatically with the actions, I am challenging the beliefs that I have. Next is the SFBT. That is, with the SFBT, WDEP aligns perfectly with the solution building. In the solution focused brief therapy, we focus on the solution, we focus on the future, we focus on the things that we can do right now, okay, to change the thing, to reach our goals. So WDEP with aligns perfectly with this, because in this we are understanding that what is our needs, what are the things that we are doing the planning, we are evaluating the things, and that's why slowly we are reaching towards the goal that we want. Next is with the DBT, that is dialectic behavior therapy. So in this we can pair the emotional regulation with the choice based action, okay. So in this we can add the emotional regulation, that how they can control their emotions, how they can work or process their emotion with the choice based action. It's like, if I am extremely angry, so instead of just throwing the things, instead of just doing that thing, how I can change the actions, or even if the needs that are not being fulfilled, how I can fulfill those needs, so that this emotional thing that is impacting me can be worked, okay. Next is with the couple and with the family. In this we have to align the needs and reduce the blame cycle, because in the couple and the family therapy, when the couple or family came to us in the starting of the session, they just tried to blame each other, okay, they will not take the responsibility. So at that time we have to focus on individual needs, and then what are the things that they can do for each other, what are the actions they can do for each other. So this is how with the couples and the family we can collaborate the reality therapy. Next is with the individual therapy, we can build the autonomy and the responsibility. It's like now we are teaching that, okay, what are the, if you are taking any actions, then it's your choice, it's your responsibility, what are the things that you can control in your life, you have to focus on that thing so that you can move forward, okay. So this is how we will include all of those things. So this is all about the theory of the reality therapy. Any doubts, any question till now, anything that is not clear, anyone? Otherwise just give me a thumbs up if everything is clear till now. Perfect. Then we can go with the practical tools overview, okay. So now these are some practical tools, or these are some activities that you can use on your clients, which is based on the reality therapy. But before we do that thing, I want you to do a simple activity with me. So do you have paper and pen with you? If not, then also it's completely fine, okay. Now just close your eyes and think of one problem in your life. Anything, any one problem. It could be anything about your career, about your family, about your personal issue, about your relationship, health, or anything, okay. Now just draw a circle in your mind. If you have a paper, then automatic, if you want you can draw it over there. Otherwise just visualize a circle, okay. Inside the circle, write or visualize all the things that you can control around that situation, and outside the circle imagine all the things that you cannot control. Like for example, in my family I cannot control other person's behavior, I cannot control if my parent scolds me, okay, I cannot control all of those things. But what are the things that is in my control? Inside the circle write all of those things, and outside the circle write all those things that are not in your control. Just think about it for 2 minutes, and then we will have a discussion on it. Is the activity clear? Okay. Just think about it. Um, have you done with the activity? Did you think about it? Anyone? Okay. Do you want to share your experience? That what is the problem that you have written, maybe not in the clear words, that did you find that you are, maybe you are focusing on the things that are not in your control, and now what are the actions you can take for that issue? Anyone who want to share? Yes, Akansha ma'am.
Yeah, I have one issue that's main very really important issue, the most important thing for me in my life. So it is so I have drawn that circle, and then outside that I have written the reluctance of my spouse for that thing, and I can control that. I can try make my own efforts and be firm in my decision, and the other things that I can't control is his reluctance, and whatever he has, maybe in at the back of his mind. So, and I also can't control that like craving, and that anxiety, and that thing that is triggering me right from time to time at different periods of intervals.
Okay. So if this situation, I'm no, thank you so much, ma'am, first of all, to telling me all about this. So in this situation, that whatever you have told me, I'm not just commenting on this. It's like definitely you are trying your best, you are doing your best. But in this thing, if this is the same case with any of the client, so at that point also we can work with the anxiety part, with the things that are not in your control. And now what are the actions the client can do with the things that they have in their control, to manage all of those things and move forward in the life. So this is the main core possibility with this activity. This activity is known as the circle of excellence, that we can give to our client to make them understand that what are the things that are in their control and what are the things that are not in their control. The things which are in their control, so why they are worrying about it, and if the things are not in their control, then definitely you cannot worry about it because they are not in your control. But now with the actions, if we can change the things, if we can do the things, then now these are the possibilities action that as a therapist with the client we can build that thing. Okay, with the WDEP model, now in this I can give you the WDEP worksheets. Now what are your wants, what are your doings, what are your evaluations, and what are your plannings, and this is how I can prepare a full session to you as a therapist. Okay, thank you so much, ma'am, for sharing your experience, and with that I am able to make it more relatable to you. I hope this is a little bit clear to everyone. Is it clear? Okay, then we can move with the activities of the day, which are these 5 activities. First is the need check wheel, second is the quality world mapping, third is the behavior choice chart, fourth is the WDEP question card, and fifth is the responsibility contract. So first activity is the need check wheel. So the theme of this activity is to create the awareness and the self evaluation in the client. So you can use this activity with the teens, with the adults, with the older age groups. The modality is, if you are taking it, you can either use it in the individual session and in the group session, and also in the couple and the family sessions. So the benefit of this activity is this tool helps the client to visually see that which needs are being met and which are neglected. That in the 5 needs, what are the five, what are the needs that is being fulfilled, and what are the needs that are being neglected or that are not fulfilled. And this will build the awareness. This will spark the motivation and guide them to focus for the change. So this is the benefit of this activity. Now how you will instruct the client? So in this you will draw a wheel, divide into the 5 session for each the basic need. The simplest thing, you can either do it in the first session or any session that you want. You will create a circle and divide it into the 5 equal parts. As I'm drawing on this, so I'm just making it like this, but you have to create the 5 equal parts. Now you will ask the client, In each part you will write the need, like in this you will add the survival, love and the belonging, okay, fun, whatever the needs are you will write it over here. And now you will ask the client to rate their satisfaction from 0 to 10. It's like, is my need for the survival is being fulfilled? From the 0 to 10, how much I will rate? 0 means the worst and 10 being the best. Okay. Then quick visual often reveals the surprising pattern, that by doing this, it's a quick visual. In this, they will have to brainstorm the things. Also, you can ask the client to draw the things that is making them sure that this need is being fulfilled. Like for my survival, I can draw my job, or I can write my job. Okay, in my survival I can write that I have a house, I am eating good foods, or whatever I have. So in this thing I am creating a wheel of my five needs, that whether it is being fulfilled or not. And also by doing this, as a therapist you will get the awareness that at which session or which need is not fulfilled in the client's life. The client will also get the insight, the therapist will also get the insight from this. So after doing this activity, you can ask the client that which need has the lowest score in all of these five needs, which has the most lowest score, and what one small thing you can do this week to raise it. It's like, if my love and the belongingness score is very low, so in this week what is one action I can take this week so that the score can be raised? Maybe I can plan a outing with my friends, a call with my friends, or anything. One action that I am taking to improve the score in each week. Okay, this is the first activity. Is it clear? Perfect. Then the second thing is the quality world mapping. So the theme of this activity is aligning the current reality with the ideal vision. That what is your quality world? What is the ideal vision that you have about the things? And what is your perceived world, or what is the current reality that you hold? This is very suitable with the teens and with the adults. You can use it in the individual session, couple session, family therapy session. The benefit of this activity is this mapping exercise highlights the gap between a client's ideal life and their current reality life, creating both motivation and focus for the change. Okay, so in this thing, you can create two columns. It's like, this is the sheet, you will create two columns. Okay, this is the quality world and this is the current world. Quality world and the current world. In this thing you can either write the things that you want in your life, okay, the ideal vision of your life. You can either write it in the words, or either you can write down, or you can just draw it or color it, whatever is suitable to you. Okay, now this is your current reality. Like maybe I want to be a topper, I want to be a successful model, I want to be a great dancer. What are the things that you are writing in the quality worlds, and what is your current reality? Like maybe I'm an average student, I don't have a good looks, or something like this. What is my current reality? And the each life areas, the client will note their ideal and their current state. Okay, then circle the area with the biggest gap. It's like, in the quality and the current reality, which thing has the greatest gap? Like for example, I am a failure and I want to be a topper. This has the greatest gap. Here, you cannot see that the reality, or there is a immediate action that I can take. And because of that thing, now my situation is being worsened. So, this is the main thing. This is how you will get the insight about it. Also, if you want, they can just do one thing more in this, that if they have written their quality world and their current situation, you can ask them to create a bridge in between those, and in this they will write the actions that they can do so that they can reach to their quality world. Okay, so after doing this, you can ask the client that which gap feel more urgent to close, which is one thing that you want to work upon. So this will be helping you in the goal setting. And what's one step that you can take this week to move forward or to move closer to your ideal in that area? It's like, what is one action that we have drawn on this bridge that you can take so that you can move forward towards your quality world? And the client walk away with the clear priority to the work upon. So that what are the things now they can do, so that they can reach towards the goal that they have in their mind. They can reach towards the vision that they have in their mind about their life. Okay, so this is again a simple activity, can be used when the client is completely resistant. They are not engaging much. You are feeling that they are not taking the responsibility, there is no insight in the client. Okay, there is they are just doing the catharsis, they are not taking any responsibility. So that's why we will create this activity for them, so that they can work upon it. Okay, next activity is the behavior choice chart. So the theme of this activity is linking action to the needs and the consequences. Age group is teen and for the adults. Modality is individual, couple and the group session. Benefit of this activity is this tool help the client to see the hidden purpose behind their action. That what is the purpose that is behind their action, the connecting behavior, that how one behavior or how one action is related or connected with the other behavior to the needs they are trying to meet and the consequences those actions create. Like for example, if I am bullying, and if I bully one person, then next time I will again try to bully that person. So now what is the hidden thing, what is the hidden need that is behind it, and now how one action is impacting my other action. And also they will understand the consequences of the action that they have created. Okay, so the instruction of this activity: create a three column. First is the need behavior, second is the need it meets, and third is the consequences. Okay, simple. In this thing, I'm just creating the three columns. In this I will write the behavior I do, it's like the bullying. What is the need that is meet? Like for example, the need for the power is being fulfilled. What is the consequences? Now I lose all my friends, or no one wants to talk to me. Okay, so in this they are doing this thing. So you can give them this to the homework, so that they can understand about their behavior, their needs, and what are the consequences they are facing. Also, the client will list their regular behaviors. What are the regular behaviors they do? Like for example, whenever their parents ask them to eat healthy, at that point they shout at them. Okay, they just try to hit them. Okay, anything like this. So what is their regular behavior? And identify that which need each what sorry identify which need each meets, that what is the thing that is meeting with the each need. And also consider both the positive and the negative columns. Like in this, in the consequences, what are the positive things and what are the negative things that I am gaining with that action. Like for example, if I try to help anyone, um, because of that everyone loves me, so this is the positive action. And when I try to bully someone, everyone hates me, so this is the positive thing, and this is the negative outcomes that I am getting from my regular behavior. They may have a 20 to 30 regular behavior, so you have to see each and everything. Then brainstorm the healthier alternative for any unhelpful behavior, so that we have to find the alternatives, that what are the things now they can incorporate in their life, what are the new actions that they can take in their life to meet that need, and because of that they are doing these unhelpful behaviors. Okay, like for example, if I have a conflict with my parent, at the time I just shout. So now in this thing, instead of doing this, I can go with the I statement, I can try to communicate with them, I can just write it out, I can do the scribblings, I can use any art based activity, I can, at that point I can just calm myself down. So these are the alternative behaviors that you can teach your client. Now after doing this activity, the discussion is, ask the client that what need are you really meeting in this, that what is the need that is being fulfilled, and what's the other way to meet that need without the downside. Okay, so what is the other way, what is the alternative to this need, how to fulfill it without doing this negative behavior. Okay, and client will leave understanding their own motives more clearly with the healthier options in their mind, that now what are the healthier options I have, and they can select from it and they can apply it, so that the unhelpful behavior can be replaced with the helpful ones. Is it clear? Okay. Then the WDEP question cards. The theme of this activity is, which is the structured self reflection, in which they will do a proper structured self reflection. It's like asking them the WDEP questions. This could be used with the teens, with the adults, in the individual and the group sessions. This activity make the session more interactive and shift the responsibility for insight onto the client, increasing the engagement and ownership of the solution, so that they can see that what are the things they are doing. Now they will evaluate the things, they can plan accordingly, and they can understand their needs. Okay, the instruction is, you can prepare the card with the WDEP based questions. So you can even prepare, either you can give them the worksheets, or you can prepare the different cards. One card just have the what questions, second have the D question, third has the E question, and fourth has the planning questions. Okay, well, questions such as, what do you really want right now? This is a what question. Is what you are doing is helping you get it? This is a evaluation question. So these are the questions that you can add, and let's client choose the card and answer it honestly. It's like, you can just prepare the different cards, you can give them, they can select any card and they can just answer it out. So it can become a proper interactive and the self reflection session, where the client feels that they have the choice, they can do anything. And sometimes the clients who don't just want to do the worksheets, they do need the real practical things, so this could be like helpful for you at that point. The discussion is, follow up with, what did answering that make you realize? If you are answering that thing, what it is make you realize? Did you get anything about from this? What are your insights about it? And what one step you can take now? What is the thing that you can take now to move forward in your life? Okay, and client often discover their own motivation without being pushed. When they see that what are their needs and what are their doings, they will automatically evaluate, and this will create the inner motivation in them. And in this, we are not pushing them, we have just given them a mirror in which they are seeing all of those things, and we are not pushing them out, we are not confronting it. So this is the beauty of this psychotherapy, and this is the beauty of this activity. Next is the responsibility contract. So sometimes some people don't commit very well, or sometimes they feel like that, okay, in this session if I have do this, in the next session if I am doing that, so it's like they are not taking that responsibility. So to create that thing, even for the adults, for the teens, we can create a responsibility contract with them, so that the commitment to the action and the accountability will be there. Sometimes clients try to deceive the things, that this is not being planned, this is not being discussed, we don't have to do like this, because when they don't have this responsibility, they will not do that thing. So to create that responsibility, you can even create a responsibility contract. So this can be used with the individual, couple and the family session. So the benefits of doing this is, this will turn the vague in the intention into the concrete and the time bound action that the client feel personally committed to completing. It's like, today I am creating a contract. Okay, it's like just creating one thing on the page, that in front of the therapist, the client will for next week they will daily do these habits. Like for example, daily they will meditate for 2 minutes, daily they will go to the office and give one compliment to someone else, something like this, in which we are giving them the concrete actions, that what are the actions they have to take it to, the time bound, that how, for how long they have to do, and that's the client feel personally committed to complete it. It's like, in the next session, like this is for 1 week, you can even create the contract for 1 month or 1 year, anything that you want. Okay, that this is my responsibility and I am committed to this, and that's why I have to do this thing. So this is what we have to create in this. So in this, together with the client, write down the specific action they will take, when and how often. Add a review date, like after 1 week we will do a review, after 2 week we will do a review, and have both of you sign the agreement. It's like a proper contract kind of thing, but of course without any notary kind of thing. It's like you can create a contract on the normal paper. Now the discussion is, ask the client that how confident are you about this plan. Okay, and what might you get in the way, what are the things that you are gaining. Even if with the teens you can add a positive reinforcement, like if you have done this thing, after 2 weeks we will I will ask your parents to take you on the to the movie that you like. You will get a small gift from my hand, and in that gift you can add the different coping tools kind of thing, or anything that you want to give to your client, or even a simple book, anything that you want to give them for the positive reinforcement. And by doing this, the client leave with a signed commitment and the realistic strategies to follow through, that okay, now I have to do this. Now they will feel committed, now they are responsible for that thing, now they will feel accountable. Sorry. So these are about the 5 activities. Any doubts till now? Any doubts? Okay. Then this is a case discussion. So this is a case of a Priya, who is a 28-year-old who is recently moved to a new city for work. Now she feel lonely, struggle to make new friends, and spend most evenings scrolling on her phone. She want to feel more connected and confident socially, but avoid going out because she feel awkward in the new groups. So at work, she stay quiet in meetings and worries that the colleagues see her as an uninterested. So this is what she do. So now the question for discussion is that which reality therapy tool could best help the Priya address her current needs. Second is, how would you apply that technique step by step. Third is, which of the Priya basic needs are unmet right now. Fourth is, how can you use the WDEP framework to help her plan the specific action. Now whatever we have discussed, you can take 2 minutes, and then you can just type the answers in the chat box, and then we will have the discussion over each point. Anyone has the doubt in this case, in the questions? Is it clear? Yes, you can give the behavior choice chart. Anyone else who want to take a shot? There is no right, no wrong. We all are learning something. So it's fine. You can use the REBT to challenge the thoughts. Quality world mapping, yes. And in that thing, you can add a bridge in which you can add the small action so that she can move towards the quality world. Definitely, yes. First of all, which, okay, what is the basic need that is not being fulfilled in the client's life? Social needs, yes. Love and the belonging. Fun is also being missing, but basically the love and the belonging, because she wants that everyone accepts her. Okay, so the love and the belonging thing that is not being fulfilled in the client's life, definitely. This is the basic need that is being unfulfilled. Now, how would you apply these techniques, and which techniques you will use from whatever we have discussed today, or anything that you have in your mind? So in this thing, you can either give the client the circle of control that we have discussed. Of course, you can give her the WDEP worksheet so that she can see that what are her wants, what are the things she is doing. Now she can plan the things. Now for the action thing, you can start it with the simple, or one or two activities, like if she like, instead of just being on the phone, she can just call a person from the office, or she can have them on the social medias, and she can just add in the group. Okay, a few small steps so that she can feel motivated, she can plan for the things. Okay, and this is how with the WDEP, or in the planning part, you will plan the small actions that she can do. In the evaluation part, or in the WDEP thing, or in the behavioral chart that someone has told, with the behavior thing, she can see that what are the things she is doing, what are the things that she want, and how both of the things are contradicting to each other. That's why by understanding all of those things, she can move forward. Okay, and also you can go with the need check wheel so that you can understand the needs properly. Also, you can create a responsibility contract with the client, that for the next 1 week she will try to have a call with her colleagues, she will try to work on that, she will try to give a compliment, a simple compliment to two people around them. Okay, so that's why she can feel confident, she can feel that okay, everyone is accepting her, she can feel connected. And during the times when she is on the phone, she can try to be in the group. Okay, so this is a small action that she can do, that instead of just feeling lonely, instead of just struggling with the new friends, she can spend time with them. And with the time when she is feeling very awkward, when she feels like that my colleagues will not helping me out, she can go with that thing. Yes, definitely, Shakti ma'am. This is the exact thing that she can do. She can talk to any one person at work every day, definitely. And if this is very hard for her, then she can give them a compliment, or she can give the smile to three-person. So this is how that awkwardness can be removed with the small actions on the daily basis. Okay, is it now clear that which tool is best? How you can use the WDEP thing to address her needs? For this thing, we can create the wheel for her, and then how to apply the techniques, how to create that action plan for her. Gratitude journaling can help. Yes, gratitude journaling can also helpful for her, so that she can feel grateful for her own self. And this is how the confidence that she don't have can be built. And on the daily basis, that positive affirmation she can give to her own self after the day. If she is doing that thing, like she can go to the office, she smile to the three people, and then give compliment to one employee, anyone like that. And when she came back home, she can do the gratitude journaling now. This is how we can incorporate the gratitude journaling with the reality therapy. Learn new things. She can learn new things, but in this we have to work on the needs of the client. Okay, she can learn, but how it can remove the awkwardness, how she will feel more loved and belonging in the group, how she will feel that fun part. Okay, yes, she can learn new things. She can like go to the gym, she can add one or two hobby activities, and with those friends she may get the confidence, and after that she might have the confidence to talk to the colleagues. Then yes, it may work, it can help out, but it is not a proper solution to her. It will take a lot of the time to be built, and sometimes the client don't have that much time. They want to see the immediate effects on them. Like you can add this thing that instead of just scrolling the phone, she can go to the gym or something like this. Maybe. Anyone else who want to add anything? So now is it clear that what is reality therapy, how it can be used in this? Yes, theater can give the quick results, because in the theater thing or with the psychodrama, we can do the role plays, we can do those things, and with that thing she can do one step or two step. We are training her that how to take the action. But in this thing, psychodrama will help when she is not able to perform well, when she is not able that how to act out properly. But first we have to create that motivation, first we have to give her the insight. So in the insight we can do that thing, and in the planning we can add the psychodrama, the technique from this. Yes, this is right, that's what I told now, that we first we have to work on the thinking. This is what we have learned about the behavior, that acting and thinking, these are the two parts. For the thinking we can work with the WDEP. If she has the problem in the acting it out, to do it out in front of them, then definitely the drama will help, the role plays will help, so that she can become more confident. But according to the case, she just recently moved to the city. It is not saying that she has a problem in that thing. So it may be skipped and it may be used in the both ways. Now clear that with this case, with the different reality therapy things, how we can do that thing with these different tools, how we can help her. That first we can ask her to create that need wheel, so that she can understand that what are the needs that she have. Then we can give her the WDEP worksheets. In this thing she will learn about all of those things, and then she will get the insight, this will give her the motivation. And in the planning we can add the small actions that she can do. Also we can use the quality and the quality world mapping. In that thing we can ask her that what is the vision of her life and what are the things she is doing, and then we can bridge it out with the small actions. Then we can add her the circle of the control activity, in which she can create the circle. Now in that she can write that what are the actions she can take for this thing, so that first she will brainstorm that what are the actions she can take. And after that thing we can add that we can create a responsibility contract with her, that with for the next week what are the responsibilities of the client, what are the things that she have to do. And this is how we are using the reality therapy with this client. And over a period of time, it's like after 4 to 8 session, she will become very confident. Now the social relationship with her colleagues are completely being formed. With those things, of course, you can add the art therapy, the psychodrama, expressive art therapy, the CBT, the REBT, the mindfulness based technique, which include the guided meditation, PMRT, anything like this, that will help her to be more confident. So that other the lifestyle changes can be changed. If she scrolls her phone a lot, then of course you can use the cinema therapy in this. You can give her 2 to 3 pictures on the social things to build her confidence, that how a person feels when came to the new place, and how she can become more friendly with the other people. So of course you can add all of those things. So that's how you can use the reality therapy as the directive and the indirective form. Clear? Any doubts? Anything that is not clear in this session or in this case? So by doing this, we just came to the conclusion. So today we have learned that what the reality therapy basically focus on the present choices, that what are the present choices that you have. We are not dwelling on the past. Then we learn that all the behavior aim to meet the 5 basic needs. Next is the awareness plus evaluation plus planning, where we have created the insight about the things, where we have evaluate that what are the things that we are doing and what are the consequences of it. Then planning, that what are the things that we can do or what are the actions that we can take. This will lead towards the empowerment, this will lead us towards our quality world. Next is work for the individual, couple, families and the group, and it blends well with the other approaches for the practical change. This is what we have seen in this case. Okay, now the core message from all this workshop is you cannot control everything, but definitely you can control your response. So this is all about the reality therapy. Last thing, that any question, anything that you want to ask, anything that you want to say before we end this session, whether you like the workshop, not like the workshop, anything that you want me to change in the upcoming sessions, anything. Anyone? Like it, not like it? Am I audible? Okay. I hope that everything is clear. If there is any doubts, any question, then you have my number. You can contact me personally also. So I'm happy for the responses. Thank you so much, ma'am. This literally motivates us to get more and more things. So the number is already in the group, and from where you have get the link, um, that is shared by my number. Okay, otherwise you can note my number, that is 87501 97301. I'm just typing it in the chat box. Just a second. Okay, you can just add. Uh, you can ask me on this number. I'm happy to help you out with the things. And as you know that this workshop is free of cost to attend, so you will get the recording of this video. And if you need the certificate and the resources for this workshop, then it just cost for rupees 149. You can even contact me on this number in the groups, the links will be shared. You can just fill the form and you will get the certificates and resources in next 3 days. Okay, along with this is all about today's workshop. And also we are coming with a 3-day course on the CBT therapeutic immersion, in which we will learn that how to step into the emotional clarity and the most powerful self. We will use the simple use how to use the simple CBT tools to turn the challenges into the growth, the empowerment of the client, how to clarify the things, how to take the ownership. And if you are a therapist, then of course how to use the CBT in the proper manner. So this is all we are going to learn about that. So the course is starting from tomorrow. It's a 3-day course happening on 27, 28 and 29. The timing will be the same, 5 to 6:30. So it's a 3-day course, although the original price is 2399, but we are running a early bird discount at rupees 599 only, and we only have 10 seats. already the 6 seats are being filled. Only I have 4 more seats for this course. Anyone who want to enroll in this, of course you can contact me on this number and get enrolled in that, in which we will cover everything about the CBT, the tools, that how you can use it. And in that you will get the proper insight that if you have any client, how to use it according to the client's need, so that everything can so that your client become more empowered. You can use this therapy more effectively. Okay, and also it is a proper space so that you can get a proper clarity. You will feel the grounded transformation and the sensual self awareness. You become aware about yourself and about the other, how as a therapist how you can work on yourself and on your client from the root level. So it's all about that. I hope I can see you again in the upcoming sessions. Also, you can join us in the groups, because we although come with a lot of the free sessions. So I hope this might be helpful for you. Otherwise, thank you so much for being here. I hope I make myself very clear. I hope you like this workshop, and after this workshop, you have learned something so that you can apply it in your life. Okay, so this is everything from my end. Thank you so much, everyone. I hope that you have a great day or a great life ahead. Thank you so much.